RSV is a common virus, especially during these colder months, but young children and seniors are at risk of getting seriously sick from the virus. Dr. Marian Michaels, who works at UPMC Children's Hospital of Pittsburgh, is here to answer our questions about the infection, because I do think there's a lot that people don't know about RSV. So good to have you here.
Thank you so much for having me.
So let's start with just the basics. What is RSV? What are some of the telltale signs that you have it?
So RSV, as you said, is really one of the most common viruses that we see in the United States, in the world. Everywhere in the world, this virus, by the time you are 2 years of age, you have seen this virus at least once.
Yeah.
And because of that, it really is one that is the most common cause for children to actually also go to their doctors, and on rare occasions actually to be hospitalized from it. Yes, of course. So most times it's just a cold. So you get a runny nose, you get a little bit of cough, you can get a little bit of fast breathing, fatigue, and most children will do just fine with it.
Yeah.
But it's that young child who really sometimes can't handle it, gets dehydrated, that becomes a problem.
And so let's talk about the spread of it, because like much of the viruses and illnesses, especially with young children, can spread pretty quickly.
Yes, so this virus does spread easily. It's one that goes on droplets. So when someone coughs or they sneeze and they haven't covered their mouth, or they cough into their hand and then shake hands with you,
right,
you have just gotten RSV from them.
There you go, just like that.
So really good hand washing. Also, it can stay on your hands for about 30 minutes, so that's why hand washing is really, really important. It can stay on the shelf, it can stay on the doorknobs. So again, really learning how to take care of that, wash those frequently when there are young kids, and keep kids home when they're sick.
Dr. Michaels, we have a segment coming up a little bit later about disinfecting, so I'm really excited now hearing some of the things that you're talking about. You mentioned the cough that can come along with this, and I know oftentimes doctors will ask, or a nurse during the intake will ask about what kind of cough they have. Will that help to tell what kind of virus it is?
Yeah, so not in general, because all of the viruses can cause similar symptoms. But when we have children that have RSV, when it's RSV season, we will more likely see a wet cough and then also have wheezing. So about 20% of the children that get RSV will actually have it go down into the lungs deeper rather than just that upper respiratory infection. And that's when you'll hear people talk about wheezing.
I'm so glad you brought up the season, RSV season. When is that typically?
Well, that is a great question. So forever, especially in Western Pennsylvania area, before pandemic happened, I could tell you, it usually started in the fall, somewhere between October and November, would sort of peak around January and then fade away by March and April. Now with the pandemic, when it sort of stopped everything, when we were so good at masking, at washing our hands, at closing down the schools, we actually had a period where it went away. And when it came back at a very unusual time. It came back sort of in July. And even this year, where we're getting back closer to normal, it really came a little bit early. So October was when we started to see it. Really peaked around December, and we're beginning to have it come down. But even now, we're still seeing about 50 cases a week.
Wow.
Yeah.
So a lot of people are still getting this. Let's talk about some of the options out there for vaccines. I was telling you, I just saw the commercial for seniors to get the vaccine against RSV, and particularly they were talking about preventing lower respiratory infection with this.
Yeah, so the vaccines are so important, and they are new this year. So I can't say how excited we have been waiting for these to come out. So there are 3 different types of vaccines. There's the one for senior citizens, because of course, aside from children, so young children are the most likely ones to get hospitalized, but senior citizens can actually get very frail with this virus as well. So we want them to be protected, and they should talk to their physicians or their healthcare providers. The other vaccine is for pregnant women, and that is so important, mostly to give that protection from them across the placenta to the baby, so that the baby has protection when they're born. So that's also incredibly important. And then for the babies, it's been approved, but we just have a shortage this year of a monoclonal antibody. So it's a little different from a vaccine, but it gives them protection for the whole RSV season. So for next year, anyone having a baby really should be talking to their pediatrician
about this.
About that.
Thank you so much for, I mean, again, like you said, many of us have had it or come in contact with it.
Yes.
But it's still just so important to know all the details about it. So thank you so much, Dr. Michaels.
Thank you so much for having me.
So good to have you here. And to learn more about treatment for RSV at UPMC Children's Hospital, we're going to have a link on our website, kdka.com/talkpittsburgh.